Today, we'll look at vertigo disease and why it occurs, the causes of it, and how to treat it. A few years ago, I slept with Bluetooth earphones on my left side. When I woke up, I endured nausea accompanied by dizziness and pain in my left ear. I tried to get up without thinking, but couldn't fail to stand up. I felt momentarily unable to collect myself, as if tons of weight had pressed me down. How much time has passed? Has an hour passed? Or was it an hour, like 5 minutes? Thinking I couldn't stand up, I slowly turned to the right, considering everything had to be balanced out. How much time has passed? Like something being sucked under the snail's tube at a particular moment. I think I'm okay, right? With that, I felt that the dizziness had disappeared, and I was returning to a clear mind. It took a moment, but it suddenly occurred to me that I could make a life of a lame man. As if I had some terminal illness, I started searching the internet for the cause, and in the end, I found a few sites that explained it most accurately and made a video. Otolithiasis is not an incurable disease, but the simple explanation is that dizziness occurs when a small block of stone in the ear moves out of place for whatever reason. The organ does not move the otoliths that have entered the semicircular canal, although they do not cause dizziness when they are still. When you lie down, get up or turn your head while lying down. The otoliths in the semicircular canal move and stimulate the function of the semicircular canal. For example, a tube contains water, and a small stone is inside. It is silent without waves when it is still because the stone does not move. However, if the stone rolls sideways as the tube moves, it creates a ripple in the otherwise silent water. In other words, the otoliths contained in the semicircular canal move and waves are generated, and these waves affect the dizziness-related organs located at the end of the semicircular canal, causing dizziness. These waves do not last long but disappear after a short period. So the dizziness caused by urolithiasis does not last long. I'm curious about the cause of otolithiasis. We don't yet know precisely what causes otolithiasis. Known causes of otolithiasis include trauma to the head, prolonged lying position, and inflammation of the inside of the ear, especially in cases of trauma to the head. Otoliths often fall off the otolith organ and enter the semicircular canal. In addition, urolithiasis is more likely to occur when surgery is performed in a hospital and lying down for a long time. In addition, otolithiasis is said to be slightly related to high blood pressure, diabetes, hyperlipidemia, and thyroid disease. However, most otolithiasis cases are unexplained, and the cause is unknown. On the other hand, it is associated with low levels of vitamin D, and the incidence of urolithiasis also increases during times of stress or anxiety. Isn't it difficult to treat otolithiasis? The treatment is simple if you know what kind of disease otolithiasis is. The otolith, which has physically entered the semicircular canal, is inserted back into the otolith organ, which is its original place. The first step in treatment is to determine which part of the otolith is in the semicircular canal. The semicircular canal is present on the right and left sides, respectively. And there are 3 anterior annular canals, posterior lig canals, and horizontal semicircular canals. Smaller otoliths sometimes float in the semicircular canal, while larger otoliths are attached to the middle or end of the semicircular canal. If you think about it this way, the number of cases is higher than you think, right? Confirming that otolithiasis is present in a specific part of the treatment is the first step in treatment. Afterwards, otolith correction surgery is performed according to each case. For example, if the otolith is in the right posterior ring canal, the patient will lie down with his head turned to the right while sitting on the bed, and then the head will be turned to the left. Otolithiasis, which is easily treated, improves immediately after treatment, and treatment takes less than 5 minutes. Sometimes, however, some otoliths are not easily treated. In particular, otolithiasis attached to the horizontal semicircular canal takes a long time, and the patient may need to perform otolith, self-rehabilitation, exercises at home. This will cure the disease, and if you take medication for any lingering dizziness, you will usually be cured. I know that otolithiasis often recurs. Otolithiasis is a disease that recurs more frequently than expected, with recurrence occurring in about 15 of cases in 1 year and 50 in 10 years. These recurrences arise most often within the first 6 months, and we usually see patients with relapses when we are actually in the hospital. Medications to prevent the recurrence of urolithiasis, vestibular rehabilitation for dizziness, and posture restriction to prevent urolithiasis were ineffective. There are 3 ways to reduce the recurrence of urolithiasis. The first is the most important one: vitamin D supplementation. This is because vitamin D is vital in calcium absorption, a component of otoliths. If vitamin D is deficient, calcium levels in the otoliths will decrease, and the otoliths will also become poor and weak. Eventually, these otoliths will fall off and cause urolithiasis. Therefore, to prevent recurrence, it is recommended that you take vitamin supplements first. The second way is the sleeping position. When looking at the sleeping position, those who sleep on the right side are more likely to have urolithiasis on the right side, and those who sleep on the left side are more likely to have urolithiasis on the left side. Therefore, resting on the opposite side of the urolithiasis can help prevent a recurrence after treating urolithiasis. The third method is to engage in adequate physical activity and exercise. Lack of sufficient physical activity increases the risk of urolithiasis by 2.6 times. So adequate physical activity and exercise after symptoms can help prevent a recurrence. These 3 methods can reduce the recurrence of urolithiasis. If urolithiasis occurs frequently, it is recommended that it be performed.